An estimated 15 million people have been diagnosed with chronic obstructive pulmonary disease, or COPD, but an estimated 24 million are affected by the disease. It's the third leading cause of death in the U.S. behind heart disease and cancer. Here today discussing COPD and its impact on patients and their quality of life is pulmonologist Dr. Brian Carlin. Good morning, doctor.
Good morning, Olga. Thanks a lot for having me here today.
Thanks for being here, because I think we have to create a little bit more awareness regarding COPD. So let's talk about symptoms and who it affects.
COPD, or chronic obstructive pulmonary disease, as you referred to, is a disease that's it's a combination of diseases known as emphysema and chronic bronchitis. Patients who have COPD often don't know they have it because it hasn't been investigated, and they have symptoms such as shortness of breath, wheezing, cough, or mucus production. They often haven't talked to their primary care providers or their physicians.
Because they probably think it's no big deal.
They think it's related to their cigarette smoking, which in often cases it is, because most COPD is related to smoking cigarettes, but they haven't really investigated it. And unfortunately, the healthcare provider hasn't investigated it either.
And doctor, are there specific guidelines for medical diagnosis of COPD? The
way we diagnose COPD is with a term called spirometry, which is a breathing test. It's a simple breathing test. It's done oftentimes with a small handheld spirometer that you just have the patient take a deep breath in and blow into the machine as hard and as fast as they can.
I've seen my parents do this. And they've actually done this a couple times.
It's great, and it's very, very easy to do it. But unfortunately, of all the people that have COPD out there, there's 24 million people you talked about, only 12 million have ever had that test done.
And why is that? Why isn't everybody getting that test?
It should be. It should be. And
do you have to ask for it?
You should ask for it. You should ask for it. In fact, one of the things that a patient should ask for if they're concerned about it is ask their doctor, can I have a spirometry done? The reason it's not done
why isn't a doctor doing it?
Is most of us, when we went through our training 10, 15, 20 years ago, it really wasn't taught to us in medical school and residency. We knew that there were pulmonary function tests that were there to be done, but we really weren't trained on how to do spirometry. But it can be done very simply. Almost any physician, healthcare provider, nurse practitioner, PA can do this in their office
And I can only assume that it would be a dramatic difference in terms of people being saved because of it.
Absolutely, because what we can do then is we know that the person has COPD, or if they're short of breath that's due to some other reason, we can make the appropriate diagnosis, and then we can treat the person appropriately.
Let's talk about a very special patient. His name is Chuck Morrison. He has and has suffered with COPD for some time.
Yes, Chuck had COPD and had the typical sequelae of COPD. Chuck had to use oxygen, and unfortunately, Chuck passed away about 3 months ago.
Oh, I'm so sorry.
And one of the things that Chuck had started actually before he passed away was a foundation or a campaign that can help detect people at earlier stages of their disease if they have COPD.
And I know he made a video because he wants to create that awareness, and I'd like to show that to my viewers. So let's do that.
Yes.
Let's take a look.
Before my dad was diagnosed with COPD, it really seemed to be just a slow progression of everyday activities becoming increasingly difficult, and it just seemed it was a little harder to catch his breath as time went by.
Go up 2 flights of stairs and I'd be tired. Then after a while, it was 1 flight of stairs.
By the time my dad was diagnosed with COPD officially, he had already lost about 50% of his lung function. And I think, like most people, it occurs so gradually that you're hardly aware of it. So by the time you get diagnosed, you can look back and say, wow, okay, I can see where this began. But you really didn't notice it as it was happening.
COPD lends itself to being a couch potato, because if you sit still and do nothing, you can breathe. As soon as you start doing something, it's hard.
And I know the family wanted us to show the video because although he has passed, and my condolences to the family, he is really leaving a huge legacy behind through a foundation.
His son and his family members have put together a foundation for early awareness, or an awareness campaign for patients who may have COPD.
And how are patients today managing their COPD?
Yeah, the best way of managing it, and there's great guidelines out there, there's great treatments out there that can help people, and there's really 2 forms of treatment. There's medical treatment, or medicines that are either inhaled or taken by mouth, and then there's also treatments that we often don't think of, such as pulmonary rehabilitation, which is very similar to cardiac rehabilitation, where people will go to a program that provides exercise and education, and can also counsel people on the difficulties they're having with their COPD.
So important to note that if someone is diagnosed with COPD, not only is early detection key, but there is hope out there today.
There is a tremendous amount of hope out there, and I can't name the thousands of people that have been helped by the medical and the rehabilitative therapies that we have available today.
Thank you so much for your time today and for all the information.
You're welcome, and it's been a pleasure to be here today.
I also want to thank Chuck's family for providing that video. Thank you so much for that awareness and for what he has left behind.
Yeah, Chuck and the legacy that he has left behind through his family and through the Right to Breathe campaign is going to help thousands and thousands of patients detect their disease earlier.
Great stuff. Thank you, sir. And if you'd like more information on this topic, go to copdtogether.com. That's copdtogether.com. Of course, you can also check out our website, thebalancingact.com.